Welcome. And thanks to our sponsors, St. David's Foundation, US Tomorrow, and Grayline Corporate Counseling Firm. I'm Suzanne Nuccio, co-founder of Transitions and Decisions, and have been given the privilege of introducing tonight's guests, starting with Dr. Jessica Zitter, nationally known palliative care physician at Highland Hospital in Oakland, California, filmmaker, author, educator, and speaker. She is also a wife and busy mother of 3 beautiful grown children. While passionate about many end-of-life issues, tonight she will be talking about caregiver burnout. We welcome Dr. Zitter to the Transition Decisions virtual event. Joseph Kopser will be the event moderator tonight. Joseph is a tech entrepreneur, businessman, innovator, and visionary. He is the CEO and Grayline Corporate Consulting Advisor to US Tomorrow. He is known for being a generous force in the Austin community and a fierce family man. We welcome Joseph to this event, along with his tech support, Nora Anderson.
Thanks, Suzanne.
Yes. Dr. Perez is a longtime family caregiver and an adult and geriatric nurse practitioner who specializes in palliative care and hospice, in which she has practiced over the last 19 years. She is a recent book author of Goals Wishes, does advanced care planning with the Nurses Care Hub, and serves on several healthcare-related boards of directors. She is active in health policy, grassroots advocacy, drafting legislation, and serves as an expert advisor for multiple palliative care and hospice topics at the state, national, and federal levels. Welcome, Dr. Perez. And last, but certainly not least, is Dr. Deborah Kircher, CEO and Chair of Transitions and Decisions. She is an author, writer, social entrepreneur, and currently working on her first book of fiction and poetry. She is the wife of a retired Air Force veteran and mother of 3 adult children and grandmother to 2 grandsons. It is so nice to have all of you with us this evening. I am so excited to get started. And with that, I'm going to hand it over to our moderator for this evening, Joseph Kopser.
Thank you, Suzanne. I appreciate it. In fact, this is a great opportunity, Deborah, to tee you up to talk a little bit more about transitions and decisions and how we got to now. And you'll see over my right shoulder, Flossie, our new puppy, is very interested in what we have to talk about tonight. So Deborah, over to you.
Thank you, Joseph. Boo's in here too. So any minute, you might see Boo.
There you go.
So Transitions and Decisions is part of an evolutionary effort to educate populations in the Austin, Texas area around advanced care planning. We have historically used the arts and humanities to accomplish our mission. However, in the past 3 years, almost 4, we have focused more on developing a digital platform that is user-friendly, literacy appropriate, and easy to navigate. We have everything from advanced care planning to bereavement to palliative care learning modules. And we're just in the process of figuring out next steps, but that is our work in the community. And we're hoping to move this forward at a higher level in the very near future. I have been able to work with people like Jessica and now you and Dr. Perez on numerous occasions when we've had conferences in San Antonio, or we've had theatrical productions in Austin, or humanities events with Jessica. So we've really had an opportunity to just explore how we have these conversations in a more creative, softer way so that it's not as intimidating. But we knew at the end of the day that having these events was not going to be enough. You've got to be able to have a next step for your attendees. You've got to be able to give them a pivot point. And so Transitions and Decisions is something that our UT students worked tenaciously on for the past almost 4 years, building this, creating a vision. We have a team in St. Louis, health literacy media team, that works side by side with our students to create this wonderful digital platform. So in a nutshell, we are all about starting these conversations at an earlier date and engaging people like Jessica in the palliative care field, people like Dr. Daniel Callahan, who was a force of nature in modern bioethics. Unfortunately, he's no longer with us, but he was a great mentor and leader in the field. And then Joseph, people like you and Aaron are in different sectors, and yet Aaron is in the palliative field. You're in the, corporate entrepreneurial field. So we need all of these sectors having conversations, because it is, at the end of the day, it is a workforce issue. It is a family issue. It is a friendship issue. And the sooner we start having these conversations, the better. The younger, the better. So we work from 18 to 80 on these conversations. And I can tell you from experience, 18-year-olds up to about 50, they just seem to understand and take it on because this pressure of facing their mortality is not present. And once that pressure is there, it is so much harder to have these conversations. So in a nutshell, I'm sorry, I'm a little bit too long, but that is who we are.
And Deborah, thank you for that. In fact, I started talking. I was so excited. I wasn't even off mute yet. But so what we'll do for the next hour with everyone that's here this evening, and most importantly, for those of you, if you're watching tonight, which is the 22nd of April, if you're watching this evening, if you're seeing this on your LinkedIn or on your YouTube, this is live. So we have a way for you to just go in and just ask questions or leave comments or share your own story. And then what we can do is not only include your comments later on, but ask your questions with Dr. Zitter later on in this discussion when that works. So I invite everyone to stay tuned, whether you're listening to this in your car and you're just driving along and you've hit the link, or if you're sitting comfortably by yourself, or ideally you're watching this later on taped and you're seeing this replayed later on YouTube. You're bringing a loved one, like you say, Deborah, to have this very important conversation. So before we go too deep into the actual story of Caregiver and the video and the film that you made, Dr. Zitter, what do you think? Should we just play the trailer real quick for give people some context? Okay, let's go ahead and do that.
I'm not going to say I'm not scared. Who doesn't want to just go to sleep and not wake up, you know? Hopefully it'll just be peaceful and quiet and not cause too much pain to the ones I love.
We're just kind of thrust into the role sometimes, and you have to step up.
I knew the cancer was starting to take over. We weren't engaged yet, and I told him, this is your get out of jail free card. Next weekend he came out, pulled out a box. I didn't even open up the box. Just fell into his arms and said yes.
It was a pretty big decision because I basically had to leave work. How are you feeling? Are you comfortable? You're not in pain. I'm not trained for this, but this is the best thing for her.
How are you?
I'm hanging in there. It's a little tough, but I'm doing the best I can.
I'm hoping they're going to do is raise the methadone dose a little bit.
The decline has been more difficult than I expected.
What happened?
And I feel like my health is deteriorating with hers. This is a journey for the end of her life, and I want to give her the best care I can give her. It's all about love.
So, Dr. Zitter, what can I say? Well done. I I'm looking forward to this, Deborah. Thank you for asking me to host and moderate along with all the esteemed folks that are on this panel. But for me, I'm just going to tell you right now, Jessica, before we get started, I hope to hold it together this evening for the whole next hour that we have together. This week is the 2-year anniversary of when I lost my mother, and she went into hospice, but we didn't have, as Rick had, a long time to say goodbye. We literally had about 10 days with how quickly her cancer had progressed from the point where it was undiagnosed. So I personally can't thank you enough for the work that you do and that you do, Aaron, and obviously of what Transitions and Decisions does to help families, because we never had that conversation before. And so hopefully people get out of this evening something. So I have so many questions asked. I know Aaron has a lot of questions asked Jessica, but I guess the first one, Aaron, if you don't mind if I just start with is, Jessica, what's the origin story for this video and this film? I know that you've been in clinical care and palliative care for a very long time, but you even mentioned just the transition it took from being in the hospital to seeing it at home. Where would you want to start with our viewers tonight?
Well, there's so much to say, but I'll try to. First of all, I just want to thank you all for having me. And of course, Deborah Kircher, I was mispronouncing your last name for too long. You've been so wonderful in hosting me in these important conversations. And I just feel very lucky to be here. So thank you all. This film was sort of made by mistake. I did not realize when I was capturing footage of Bambi, who had invited me, being who she was, somebody who wanted to help other people. She says, write anything you want about me. You can film me. And she welcomed us into her home to document her experience. I thought that what we were doing was creating a film, or possibly creating a film about what it means to take control of your end of your life, the last part of your life, pulling in hospice. It was sort of, I thought, really about Bambi and her choices and her bravery. And what happened was, when I first saw this, the rough cut that my co-director made, Kevin Gordon, and put in front of me, I realized, oh my goodness, the story isn't really about Bambi, it's about Rick. And we then went on to make this film and, get some more footage of Rick. This Bambi had died by the time I realized that this film was really about this phenomenon of caregiver burden, which I, as an inpatient focused doctor, had not picked up the way that I now know it needs to be picked up by all of us in the healthcare system. And so we created this film that was really about the caregiver. It was really about Rick, the guy who I thought was just going to be there to open the door for hospice, but he ended up being the main focus, and his experience and all those like him. And by the way, do you know how many people that is? It's 1 out of 5 Americans. So as Rosalind Carter once said, everybody is this, I'm paraphrasing it, but every single person is either a caregiver, has been a caregiver, will be a caregiver, or will need a caregiver. This is ubiquitous. This is part of the fabric of our society, of our nation. And we need to understand that the burdens faced by these caregivers, the physical, medical, financial, emotional, psychological burdens that they are facing because they are unsupported, inadequately supported, are something that we have to take stock of and really start to think about changing as a nation, because it's going to be all of us.
Well, and that's a great segue, and I'll turn it over to Aaron, but I just want to reinforce what Deborah said that got me from the perspective of US Tomorrow, my nonprofit that focuses so much on workforce, and Gray Line, which focuses on rapidly changing demographics, rapidly changing conditions in society and workforce. And we have an aging population. We have an aging population that, because of the blessings of modern science, are living longer and longer, but there aren't as many people, to your point in this beautifully done film, to actually be trained, ready, and skilled in the unbelievable mental and physical toll. So Aaron, why don't you take it away with some questions for a couple of minutes, and then I'll be bringing Deborah and Suzanne and myself in and out of the screen as we go through this.
Well, I just want to say thank you for letting me join you guys. This is an extreme honor and privilege. And Dr. Zitter, I can't thank you enough for all of your work that you do at home, nationally, internationally, and for TAD and everybody else. But I think the question that I have is, we know that caregiving is not a new idea. There's been caregivers from the beginning of time. And I think I struggle with looking at health policy. And then, as being as frontline workers in healthcare, everybody has 100% mortality rate and everybody has 100% caregiver need. So where can we fill those gaps and where can we bridge the gaps? Because I think, oftentimes in health policy, when it's at the legislative front, appropriations and those earmarks, how can we afford to pay and help caregivers who are staying home or missing work, or their own health is suffering by caring for a caregiver? I think a lot of states and really countries are struggling as our population is exploding with chronic disease management, serious illness, and now we added a new layer of COVID-19 survivors with serious health issues. So we have another added population to an already booming population of caregiver needs. So I think, how can you help us? I think the film is just beautifully done. It's heartwarming and just touching. And how can we, I think, use your gifts and talents and viewing this to help people, not just at home, but also some of the legislatures that are viewing right now, as far as how can we help meet people where they're at, no matter what, whether they're clinicians, consumers, or caregivers, or all of the above.
Yeah. Well, I mean, you're getting right to the sort of essence of the issue. How do we afford to pay for it? How do we provide the support that they need? Well, I would say, how do we not afford to? I mean, we cannot continue along this path. We are, employers. Let me give you an example. 60% of family caregivers are employed, most of them full-time.
Mm-hmm.
And the vast majority of those people are missing significant amounts of work. They're leaving their jobs. I think 20% of them leave the workforce altogether. Employers are having to retrain people. Frankly, their healthcare costs for these caregivers are going up because caregivers are suffering so much physical burden from the experience of caregiving. Employers are ultimately losing $65 billion in caregiver burden costs. So it's a lose-lose situation. The caregivers aren't feeling supported at their places of work, and the employers are also suffering. So I would say to you, how can we afford not to? Talk about it from the perspective of an insurer, a healthcare insurer, Medicare, Medicaid, private insurer. These are also people who have potential for leverage and changing the situation, like employers. They impact the lives greatly of family caregivers because they're paying the insurance premiums. They're basically providing healthcare benefits in the post-acute setting. Yeah. And if they have situations, which they do all the time, where the family caregiver gets so sick that they can't take care, and the patient then gets into the emergency room, or the family caregiver is sick, it doesn't make sense for us not to be supporting the family caregivers because, again, the insurers are ending up at a disadvantage. So it makes sense just from a purely financial, forget ethical, but purely financial perspective for us to take caregiving and support it. And I think that is what's starting to be seen. Joe Biden has put this huge plan out there to support family caregivers of both people with serious illness, the patients with serious, and young people. And obviously this has all been, as you say, brought to the fore in COVID. We see that it's just all of these things are being magnified. And I think that there's hope that there's real potential for legislative change. This is not a partisan issue. Republicans and Democrats are all potential family caregivers. This is something I think this could be something that really takes Congress in a sort of unified way that we could really have a more unified approach to, because it's something that's going to concern us all.
Yeah, I'm 100% with you on that. I was reading some studies. In Texas, we have an advisory council for palliative care, and it's made up of all kinds of different interdisciplinary team members. And when we were doing the legislative report recommendations, we wanted to include the families and caregivers and making sure that evaluations and assessment, because I think the caregivers are the missing link between all kinds of measures and outcomes attached to quality of life and dollars and cents, literally. And I think when we were reading a study, I forgot when it was done, forgive me, but it was a study about nurses nurses caring for loved ones in their own home. And these nurses who are professionals in healthcare were having more than 60% rate of having heart attacks and death with their caregiving, associated to caregiving. And it made us think, really, if nurses who are trained are having health conditions by caregiving, what is the layperson who was not healthcare trained? And, you know, you're talking about the mechanics and the medications and everything, because really caregiving is nurse's aid. It is nursing. It is being a nurse practitioner or physician. It is social work. It is chaplain. It is accountant and housekeeper and everything in between. And sometimes chef too, and chauffeur. So I think it's one of, when we look at the caregiving burden, the symptom burden that the patient experiences, I think we also need to look at the symptom burden of the caregiver and how do we address that on a grander scale versus just having social work and chaplain kind of walk them through and guide them and process through that. You know, as a caregiver myself, I've helped care for my mom who's been chronically ill, seriously ill, almost died several times. I'm an only child. I've helped care for other family members who've had new cancer or recurrent cancer diagnoses. I've cared for my grandfather who had chronic illness. So right-sided heart failure for you guys at home, pretty significant kidney disease. And then coming to find out towards the end of life, things just didn't make sense. And then finding out he had metastatic prostate cancer, or prostate cancer that had spread all over through the bones. And being able to care for loved ones from the initial diagnosis through the serious illness phases, and then at end of life, and being there to transition as he crossed over to the next world. But, you know, I'm a working professional, you know, having to get FMLA, you know, on the federal level. As an only child, it's okay for my mom, but as the medical power of attorney and primary caregiver for my grandfather, I really think as caregivers, when we're looking to explore new ways to help caregivers, we've got to also adjust how that FMLA is working, because it's not often that caregivers fall into that black and white, this is the only way you can get FMLA to protect your job, because if you're missing and you have to go through the hospital, you've got to stay with them, or you've got to miss days like we're talking about, you know, you don't get paid for those days, but at least you've got something to go back to, because that is a great stress too. And even as a
and Aaron, if I can interrupt there, you're breaking up just a little bit. You brought up 10 really good points for Jessica to take up. So Jessica, pick any part in there of all those examples that Aaron was given. Where do you want to zoom in on first? Because I think, you know, by the way, we're almost at the halfway point. So where do you want to jump in and take any one of these issues?
Well, I just want to appreciate Aaron's passion, because you've clearly been a caregiver on multiple fronts. And thank goodness you're there to advocate, because as you say, the vast majority of caregivers are doing nursing tasks, and they're not nurses. They're doing things like changing, you know, wound management. They're dialysis catheters, you know, giving IVs. I mean, this is a really serious thing. The types of tasks that 60% of our caregivers are doing are high intensity medical nursing tasks that never would have been done by a caregiver in the past. And we just send these people home and say, do it. And I think it's extremely stressful. And I think, you know, you're clearly a trained healthcare professional, but most people aren't. And we have to just keep that all in perspective, and really think about the fact that this just isn't a way to manage with the higher intensity treatments that we do in our hospitals over the past 60, 70, 80 years. We're sending people home with higher intensity needs, nursing medical needs. We've got to provide them with those types of support. Now, I will tell you, there aren't a lot of programs that I have known, and I've been researching this. There aren't a lot of places, resources, programs for family caregivers to go for support out there in the community. So I don't want to sound like a naysayer or pessimistic, but that is the reality. However, there are some, and what's frightening is that of the resources that are out there, only a small percentage of caregivers are using them. Why? There's so many reasons. They may not know about them. They may be too exhausted to look for them. They may be ashamed to ask for help. I think that's a very important piece that we need to be thinking about. And, for that, we've got to do a better job as a society matching the caregivers to the resources that are there. There aren't enough of them, but there are a lot of them. So who is best equipped to do that? Well, I would say the hospital. Where there are patients, there are almost always caregivers. And are we paying attention to the caregivers? No. We need to identify these caregivers. We need to bring them into the conversations much more robustly. We need to be really honest with them about what they're going home to. Whether it's with hospice or without hospice, it doesn't matter. They need to understand the reality of the situation that they're stepping into so that they can start to muster whatever support, whether it's homegrown support from friends and family, or it's figuring out where the resources are in their locale to tap into and what they may qualify for, what they may not qualify for. And, there are some bright lights out there. I just was speaking to one of our volunteer chaplains who I work with, whose husband is a vet, disabled vet. And she has tremendous caregiver burden. And she just told me about a week and a half ago, she said, I just want you to know, I signed up for this program at the VA. It was unbelievable, the amount of support that they provide. And not only support, not only post-acute care in the home support with lots of nursing, but they also put money into her Social Security pension. They do all sorts of things that make sense. People are doing a job as caregivers. They should get paid for it. They should get rewarded in their Social Security for it. There's so many things that we can do. And I think the VA is one of the shining lights out there for caregiver support.
Wow, that's incredible.
And Aaron, before you get to the next question, I want to remind people that if you're watching this now on the evening of the 22nd, this is live. So those of you that are on YouTube, and I can see your account over there, I know there's several of you that are there. If you have questions directly for Dr. Zitter or even for transitions and decisions with Deborah and team, with Suzanne, drop those down into the comment section, and then I can pull them up in between question and answers. But Aaron, go ahead with your next question.
Yeah, I think how can we help also bridge the gap on advanced care planning and those conversations? Because I see there's a lot of different resources, but I think awareness, like you just shared, awareness is a challenge. I think sometimes financial costs can be a challenge, timing or transportation, sometimes even how do you start that conversation? What are your thoughts on how do we help bridge that gap with caregiving and having those gentle but intimate and very needed vital conversations?
I'm so glad you asked that, Aaron, because I think it's a critically important thing. There's a lot of talk about advanced care planning that we've been talking about, I don't know, as a community, as a nation for 10 years maybe? People are starting to understand how important it is to think in advance about preferences. But we always think about preferences as relates to the use of life-prolonging treatments. We don't have a broader definition of advanced care planning that includes things like caregiving. Not only the planning for the patient and where the patient wants to be, but the planning for who's going to take care of them in the home. That requires a plan. I've actually, since I've become more aware of this issue myself, I've started talking to my family about it. I started talking to my parents about it. I started talking to my husband about my parents about it. What is the plan? I talked about to my sister. My parents are robust, thank goodness, healthy in their early 80s. But I want to know what our plan is when it comes to a point where my parents need more support. How are we going to do it? How are my sister and I going to trade off? What are the plans? And so I think that is another form of advanced care planning that is key. I think another way of doing that advanced care planning, like we do with things, relating to mechanical ventilation, for example, is in the hospital. I think that as the palliative care team, for example, we have a responsibility not only to talk about things like ventilators and CPR and feeding tubes, we also should be talking about who's in the home. How are you going to do this? If we're going to send you home with or without hospice, who's really going to be able to be there? A geriatrician once said to me, it really takes 3 full-time people around, 3 people providing care to a geriatric patient in order for no one to really be under duress. That's a lot of people to be available to take care of someone. So how do you muster that in your own family? Might it be that you have friends that you count on? I mean, there are many ways to do this, but you have to plan in advance, just like you do for any other kind of major decisions.
That's incredible. I think that's huge. Huge. I think that should be added. That definitely has to be added, the caregiver advanced care planning.
Yes.
It has to be a value add, not an add-on. It's a value add. That's huge.
Well, that brings
I'm
up a
looking
great-
forward to your next book.
You bring up a great point there. Both of you do. So, Ellen Martin, who's watching live, she makes the comment that in her experience, the resources are available, Jessica, but they have so much limitations, not really be helpful. How do you respond to someone like Ellen who knows that they're out there, but there's so many restrictions and limitations?
I say, I'm so sorry to hear that. And I know that's true. We've got a lot of work to do to enhance our offerings and to connect you to the ones that will be most helpful to you as a caregiver. That is just work that has to be done and hasn't yet been done. So it is true that there are a variety of different kinds of resources. Some of them are available to patients with Medicaid. Some are available to patients with Medicare. Some are available with certain types of private insurance. Some require that you pay for them. To know what you personally qualify for and what exists in your locale, in your region. Say you're a rural caregiver, what's out there? There's probably not a lot. This is, I think a big part, in addition to creating more resources, is really, really having navigators, people who can help. And actually, this is part of Joe Biden's plan. He wants to put in, as part of this big plan, $775 billion, he wants to put 150,000 new, what we call CHOW workers, community health workers, out on the streets. These are people who advocate for people who have Medi-Cal, Medicaid, so lower income people, but they're advocates to help connect them and find what they need and advocate for the resources and connect them to resources. This is this could be a very useful thing for lower income families who need to understand how to navigate the system so that they can access whatever resources are available to them. But we've got a lot of work to do. And I'm so sorry, Ellen, that you've had troubles and challenges getting what you need.
And I think, Aaron, before we go back to your next question, I think that's really what you're trying to do with the film. At least that's how it spoke to me, which is we just need to be talking about it. We just need people to be raising the concern because, as you said earlier, this kind of concern is not limited to Democrats or Republicans. We are all going to face, as Aaron said, 100% mortality at some point. And so it's a tough decision for a lot of people to think through. So, Aaron, back to you for your next question or comment.
Oh, I saw Dr. Zitter. What were you going to share?
Oh, go ahead.
Well, sorry. Thanks, Aaron. I just had one quick thing to say, which is, we really, you can look, I confessed to you. Sorry, that's my dog in the background. I know we're all having dogs here. She's on her back rolling around. So if you hear that, it's that's what she's doing. We, in the hospital environment, as you know, from my personal experience and confession to you, do not have, are you hearing me or am I hearing an echo?
Yeah, no, you're good.
You hearing me? Okay.
You're
We
good.
do not have the awareness about this problem that we need to have. That is just unfortunately a reality. I didn't. I'm a palliative care doctor. You would think that I, working so closely with our social worker, would have somehow picked up what she, by the way, did know, which is that this sort of rising caregiver burden issue. Every time we discharge somebody home, she has this anxiety about what's going to happen to them. I hadn't picked that up. So when we created a workshop for medical residents, which we're really excited to announce, just one at the American College of Physicians, as it was one of the sort of first place. We're very excited about that. They liked our curriculum for medical residents, but the point was, we showed these medical residents this film, and then we talked about it, and there were tears, and there was shock. There were people saying, oh my goodness, I'm thinking about this patient last month, and I was focused on the patient. One of them said, and I won't forget this, we had this patient, I was doing telehealth with the neurologist, and this woman had had a stroke, but she was doing well at home. And she and her husband of 42 years was on the calls. We did a couple of calls, and we were so focused on the fact that she was kind of doing better and doing okay. And I didn't even register what might be going on for this caregiver, that his wife of 42 years now was hemiplegic. And what did it mean for him to get her on the commode? And it was just that you could just see these light bulbs going off in this medical residence experience. And I didn't necessarily have anything like, well, do this, this, and this, and it'll all be better. But at least the awareness was raised. And I think that's the first step to changing this.
Yeah. And Ellen, appreciate your comment. Notice at least luckily she's a nurse, so she can navigate this and just pitch in where she can. But that empathy, I think, is almost, or that understanding. So Ellen, back to you.
Well, I can shout out to Ellen. Ellen is a wonderful Texas registered nurse that I know well. So she's a phenomenal nurse here. But I think the other question I have too, this may be also not just for Dr. Zitter, but anyone, because in Texas, we have an expanded Medicaid, and we have a huge problem of accessing federal dollars for what's been allocated. And so a lot of them are uninsured or underinsured. How can we help bridge the gap for those that don't have access to those chows or have access to, how do we bridge that? Because that's my concern, is we have things in the pipeline to help people, but I don't think, when we're doing, connecting the dots for care coordination, that we truly have awareness and access, but those funds and those caregivers, I think oftentimes, like you shared, are hiding in plain sight. So how do we help them?
Yes. Well, I think you've just sort of hit on a really important thing. And actually, Rick falls into this category, which is this sort of sandwich group, not low income enough to get some of the support that Medicaid can provide, which is some. I mean, we in California have something called IHSS. I'm not sure what you have in Texas, but it's in-home support services. So essentially, minimum wage for maybe sometimes 10, sometimes 20, sometimes 40 hours a week, depending on what the social worker is able to get. The family member usually just gets a supplementation of cash for those hours at minimum wage. It's too little to really hire any significant outside help, which is really what these people need. But so, there's, and of course, a lot of Medicaid patients have access to adult day programs. Sometimes people who are employed will be able to get their benefits from their employers. If it's a very forward-thinking employer, they will get with their benefits sometimes adult day program support, or sometimes navigation support for caregivers to help them navigate and identify the resources. But the truth is, there's people in the middle. The very rich can pay for a lot of this themselves. The very poor sometimes have access to some support. But sometimes people like Rick, who are in the middle, really are the ones with the least support.
Yeah, I think that's a huge challenge because, where we see Texas is so large, we would be considered, I think, the 8th or 9th largest economy in the world. But yet, when it comes to like health outcome measures, we generally rank down below 45th out of 50 for our health outcome measures. And we cannot move past, for whatever reason, we can't just move on with the expanded Medicaid or other innovative ideas. My hope is that Texas will have some kind of movement forward like California. I think California is just tremendously progressive in trying to meet patients and families where they need. They were but I think I want to say y'all were the first state, if I remember right, that had supportive palliative care for community-based palliative care and worked really diligent to get insurance coverage and caregiver coverage, if I remember right, because Texas, we look often to our brothers and sisters in California to try and help navigate how do we help bring some of that to Texas to help. But I think that's how do we bring that when they're in plain sight? And the other thing I want to share is, when you were sharing about talking with and creating that program with your students, your fellows and residents. I was just talking to a fellow who is doing her geriatric fellowship. She was in the office, and we were talking about a challenging case that I had. And I said, they just don't understand. And I said, I truly think that to understand where the caregiver and patients are, that regardless of if you're going to nursing school or physicians or physician assistant or social worker chaplain, that we need to get in on the ground level as a nurse's aide or a tech, because there you learn the art of caregiving, empathy, compassion, and we get a front row view and also tangible experience of what do we look towards and how can we educate and support moving forward.
Yeah. In fact, Aaron, that brings up a great point. Another comment from one of our viewers, from Melissa Wu, who's talking about, as a university student, and you're referring to fellows and your fellow students, what are the things that she can be doing now, whether to prepare for later in life, or in my particular case, as I mentioned in the beginning of the event, all of a sudden, one day you're on a trip and the next day you're in a hospital. What can people do to prepare, Jessica?
Well, I would say, look, you can never know what's going to happen in life. Life can go a variety of different ways, whether it's relating to ending up in the ICU, God forbid, and needing to be on breathing machines, or it's, coming home and, mom fell and she's at home now with a broken hip and recuperating in dementia. These kinds of things happen in life. And I think all of it, you can't plan it all. What you can do is you can think about a variety of different scenarios, like mom comes home with dementia and a broken hip, and play them out. And, dad has, a terrible attack of emphysema, and do we put him on a ventilator, or does he go on a ventilator? These are the kinds of conversations that should be happening around kitchen tables. They happen around my kitchen table now. And thank goodness right now, am not yet ill, nor are my parents, but they are conversations that need to be started before they're needed. That's how you start planning for it. I think there's a lot of things you can start. If you're planning in advance and you're thinking about it in advance, I can pick up the phone and talk to my friend who lives down the street and say, if I needed you to take my dog, if I needed you to bring me meals, there are many ways. Frankly, community, my synagogue, we didn't do a fabulous, we could have done a better job at supporting Rick. It's not because we didn't care. We cared a lot, but we weren't attuned to this issue. So if you start even institutions like churches, synagogues, community centers, and thinking about the fact that, there are family caregivers right now among us, let's figure out how to support them. These are all the kinds of things that can be preparative, if that's a word. Advanced care planning around your own kitchen table, talking if you're part of a bigger community body, and making plans for how you will support the people when they need it.
Well, I appreciate that, Alyssa. I appreciate you asking that question. In fact, Deborah and Suzanne, I'm going to give you all the heads up because I'm going to come around to you in just a minute. But after I get through with this little comment, just to add to Jessica's point, which is, after my mom passed suddenly with literally almost no notice, 10 days, it caused my wife and I to have a very serious conversation with her parents. Now, luckily, they're young. They are still very healthy, and they're totally mobile. There are no concerns. But they lived in El Paso at the time, which is practically a state away. And so we spent the better part of which would have been all of the 2020, 2019, to try to convince them to just move closer to where we are, the center of gravity of Texas, where there are multiple members of the family as opposed to two of them. So that was one discussion. It's not the be all end all, Jessica. I understand a lot of more conversation to have down the road, but it was something worth mentioning. So, Deborah, what comments or questions do you have at this point with the experiences that you've had since the inception of Transitions and Decisions through the University of Texas at McCombs?
Well, many, and mostly wonderful. Thanks to many people like Jessica, Aaron, and my students, and HLM and St. David's Foundation. They're responsible for making this happen tonight. But I want to say something about the cultural barriers we have in our society that keep us from asking for help. and that keep us from giving ourselves permission to step back and let others do the caring. This was an issue my grandmother had, and she was burned out taking care of my grandfather. And my mother stepped in and basically gave her the permission that she could not give herself to get support from my grandfather. And so I think there is some cultural and ethical barriers we struggle with within our society, within our families, that asking for permission is revealing some sort of weakness, and we've got to get past that. And so ageism in this society is problematic. You know, we need to embrace age. We need to embrace the fact that we're going to need help. So I think one of the lessons I've learned through transitions and decisions in my family is that we're all interlinked. We're part of a tapestry. And when one thread is weak, it's going to pull on the others. So it's important for us to learn how to ask for the help that is out there. I mean, I think a lot of our family members and friends are just waiting for us to ask.
Yes.
Yeah. And thank you, Deborah, for that. In fact, Jessica, before you leap in, for those that haven't seen the film,
I think the question is, how do we encourage people to ask? And then also, how do we give permission?
Oh, so we lost Aaron there for a second. But Jessica, to your point, in the film, you make such an eloquent point about how Rick just needed 5 days of rest. He needed to ask Bambi to allow him to ask her, to end up in a hospice for just a few days. How do people, to Deborah's point, find the courage to ask now rather than later?
That's a really important point. And Deborah, I'm so glad you brought it up. Shame, guilt, you can understand why people will feel that about asking for help when they're caregivers, because you might feel like you're complaining. How could I not want to take care of mom? Mom took care of me my whole life. Oh, does this mean I don't love my husband because I'm complaining, or I'm exhausted, or I'm, and I think you can, I don't know if you remember this love story from the 1970s. Remember that movie? That guy, Ryan, what was his name? He sat by the bedside of, until she drew her final breath. And that was the love story of the beautiful Hollywood version of what a caregiver is. Well, guess what? Life ain't Hollywood. Okay. And that is not realistic. She would happen to be in the hospital. There were nurses everywhere taking care of her. The reality of this is new. And we've got to, it's one thing to ask the caregivers themselves to be more comfortable, asking for help. It's another, I think the even bigger responsibility is for us, the non-caregivers right now, to go in and say, we're here. You're going through a lot. You're exhausted. I'm going to do a load of laundry. I'm not asking you. I'm telling you. I mean, obviously you're not going to barge in and tell them, but you just, when people come in with a casserole, is that what is needed? Is that the most helpful thing right now? Rick had a granddaughter. She didn't like casseroles. So what would have been more helpful to Rick? So I would say it's important to, number one, come in with active, I want to do something. What's the most helpful thing of these 3 things that I could do for you? What would you choose? Mm-hmm. Number 2, it's an emotional support and saying, you're allowed to be angry. You're allowed to be frustrated. You're allowed to, want to leave and never come back. That is expected with what you're going through. Let's accept that, acknowledge it, and honor you for being a caregiver, and thank you for being a caregiver. And that is probably, I mean, I'm not a caregiver, so it's not fair for me to say, but I would imagine that would be one of the most important things that you could do, is to honor someone and validate their feelings and then help them.
So well said. Suzanne, you've been very quietly and politely nodding along with all of us. Is there anything you want to add to or comment on or ask a question of Jessica?
When you talked about the casserole, it reminded me that I work very closely with a community Bible study, and we do a lot of taking meals to people, and it's called a meal train now. You can sign up and it's available, and people can plug in what they're going to bring, and it's very helpful oftentimes. But it seems to me that it would be a wonderful idea to create a care train. Where people can go on, and because people want to help when they know people are in need. So a care train, you can list the things that are needed and plug your name in for the times and things that are needed. It's just like you've said, have the conversation, start the conversation, brainstorm it, and figure out how we can just help each other as a community, a family, in all those ways.
Well said. And I will tell you that we've created a workshop for family caregivers that goes with Caregiver Love Story. It's an 1.5-hour program that helps family caregivers think about, for them, what are the 5 things that they would find most helpful for people to do, and who are the 5 people that would be most helpful to do those things for them. So I think creating those types of spreadsheets, really figuring it out, matching what they need to what's available, is really an incredible act of grace. And I think we really need to start doing that more routinely.
Absolutely.
So Aaron, believe it or not, we are now down to less than 8 minutes left. Any closing thoughts or comments that you have that you want to address towards Jessica here as we wrap up?
I have one question for you, Jessica, in regards to caregiver burnout and mental health and self-care. What would be the #1 tip that you give our viewers for that?
What a great question. I think the levels of loneliness and isolation among caregivers is terrifying. I will tell you that I heard that this is striking. There was a study that was done during the pandemic, like 3 months into the pandemic, about caregivers, and it was found that they are 10 times more likely to seriously consider suicide than non-caregivers, 5 times more likely to use drugs or alcohol to cope with stress than non-caregivers. This is a serious public health crisis of gargantuan proportions. So I think this is an emergency. It's a public health emergency. And we've got to immediately figure out how to decompress, take some of the profound stress out of these caregivers' lives before we even start thinking about self-help and therapy and all of those other types of things. This is an emergency situation. We've got to pull out and give them some hours of support, in whether it's through, I personally think we need to do that. State and local and federal government is what should have the responsibility to pay for that. But in the meantime, let's do a stopgap and figure out this homegrown help and get these people support. And the way that I think is most helpful to do that is by raising awareness, showing people what it looks like to be in the house of a family caregiver. I hope that this movie is going to make that impact and make people start to realize that they have got to get out there and support their loved ones, friends, families, neighbors, and do this in an emergent way while we're waiting for our legislation and our community resources to catch up with what's needed.
And Deborah, what about you? As we wrap down now, less than 5 minutes left. Jessica brought up a lot of great points. In fact, even before we get to your point, Deborah, Ellen made one more good point, which is that because of new skills learned in the pandemic, she learned how to order groceries for her parents 3 hours away. So good on you, Ellen, for sharing that tip. Deborah, what's one more idea or thought you want to leave before we close and wrap up?
Well, I do think that we need to create more opportunities to access information. There are not enough resources online that are easy to navigate and understand. So I tend to be on the health information side and health literacy side of things. And I've watched families struggle with trying to understand how to read a very complex, densely populated, high-level website to try to find a resource. And we have got to do a better job supporting what Jessica is talking about in driving families to platforms that are easy to understand, easy to use, and bilingual.
Or trilingual.
Or without a doubt. Yeah.
Yeah.
Which Transitions and Decisions does. That website is a very, very easy to follow and continues to grow and be worked on. But it's a wonderful resource to start with. So check it out.
Well said. And for those of you that are viewing this, I've put it up on here, but it is transitionsanddecisions.org that we've been talking about. So that takes us back to you, Jessica, here with just less than 3 minutes left. What last ideas or thoughts do you want us to leave with in this very important cause, this film that you've produced, Caregiver? It is available online. I keep putting the link up from time to time for people to either rent or buy. So take us home, Jessica.
Well, I think that I'm all about bringing people into the bedside, next to the bedside, into the home, and hoping that it engenders empathy, compassion, and self-reflection as people realize that this is actually not only this couple, but it's them, it's us, it's all of us. And I think that there is a certain urgency that I hope that this film brings to all of us to really start thinking about making some serious change. I'm optimistic. I think we're at the very beginning of doing this. I think we have legislative things that need to be done. The healthcare world has to change and start to notice these invisible patients. The employment world has to catch up with, the best of the employers have some benefits, but for caregivers, but even in those workplaces, surveys show that those caregivers are still feeling unsupported and a little embarrassed about asking for them. And so they're not. So there is a lack of real support for caregivers in the workplace. That's got to change. There's so many elements here, but let's start at home with all of us, with our friends, our families, our communities, our churches, our synagogues, etc., and figure out what we can do to start paying attention to those among us. There's a lot of us, and we will all be us someday, so that we can make everyone's life work as smoothly as possible until we fix this problem. And I just want to thank you for having me.
Well, thank you for being with us. Aaron, thanks for joining in as on the fireside chat and asking the questions. Deborah, thanks for all that you do and that you and Suzanne do on the board of Transitions and Decisions. Any last thoughts from the group before we wrap it up and take it home?
Just very grateful, Joseph, that you put it together, and Aaron, for you being with us. Jessica, as always, good partner in crime. And Suzanne, you've been with me from the beginning, so I've been very blessed, and this has been a wonderful conversation tonight.
I agree. Thanks for joining us. And again, wrapping up, my name is Joseph Kopser, a proud partner tonight with Transitions and Decisions, wearing two hats, that of US Tomorrow, which is focused on workforce. And as Jessica pointed out, the caregivers of America do not have the support they need as members of the workforce. And hopefully, if you watch the film that we discussed this evening on Caregiver, a love story, we can change that. And with my company, Gray Line, focus on leadership and strategy in a changing world. Thanks for tuning in tonight and celebrating with Transitions and Decisions with our guest speaker, Dr. Jessica Zitter. Have a good evening. And most importantly, share this link, whether you're watching on LinkedIn or YouTube, with friends, and have this most important conversation now, because the sooner you have it, the easier it is to have that good end of life, as Jessica points out in The Caregiver. Thanks for joining us tonight. Take care.